Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to our presentation on managing thyroid dysfunction emergencies in a dental setting. Today we will explore the critical steps and strategies to handle these emergencies effectively. Let's begin by understanding the importance of recognizing and responding to thyroid-related issues in dental practice. Hyperthyroidism and hypothyroidism are disorders that develop gradually and can change a person's mental state, but they rarely cause emergencies. The most common situation where a patient who seems healthy has an emergency due to thyroid problems is during a thyroid storm. So we will focus our discussion on thyroid crisis. As we pointed out that hyperthyroidism and hypothyroidism typically develop slowly and rarely cause emergencies. A thyroid storm, however, is a severe and sudden worsening of the hyperthyroidism. It can be triggered by factors like infection, surgery, trauma, pregnancy, or stress. Patients with hyperthyroidism may show signs such as tremors, fast heart rate, weight loss, hypertension, irritability, heat intolerance, and bulging eyes. During a thyroid storm, these symptoms become much worse. Look out for high fever, fast heart rate, irritability, delirium, coma, hypotension, vomiting, and diarrhea. Before any oral surgery, talk to the patient's primary care physician to understand their thyroid condition. Ensure their thyroid hormone levels are under control. If necessary, the patient should receive anti-thyroid drugs and iodide treatment before surgery. Follow the guidelines for safe surgery preparation. If a thyroid storms occur, stop any ongoing dental procedure immediately. Call for emergency medical help. Establish an IV line and start giving fluids at a moderate rate. Keep the patient as calm as possible to prevent further stress. Try to cool the patient down while waiting for help to arrive. The patient needs to be transported to a hospital for advanced treatment. At the hospital, they will receive medications to block thyroid activity and reduce symptoms. This box provided in your textbook showing the signs, symptoms, clinical presentation, and management of acute thyroid crisis. Now let's go over the key points we have covered so far. We will quickly review the main ideas to make sure everything is clear. Remember that while hyperthyroidism and hypothyroidism develop slowly, they can still lead to emergencies. A thyroid storm is a critical situation where hyperthyroidism symptoms suddenly become severe. This can be triggered by various factors. In a thyroid storm, the signs and symptoms become much worse as compared to hyperthyroidism. Before any oral surgery, it is critical to consult with the patient's primary care physician to check their thyroid hormone levels. If necessary, administer anti-thyroid drugs and iodide treatment before surgery. Follow the guidelines to ensure the patient is cleared for ambulatory surgery. If a thyroid storms occur during dental procedure, stop the procedure immediately and call for emergency help. Establish an IV line and start giving crystallized solution while keeping the patient calm. Try to cool the patient until help arrives and transport them to the hospital where they will receive further treatment, including anti-thyroid and sympathetic blocking drugs. To conclude, a proper management of thyroid emergencies in dental settings involve preparation and a quick, effective response. Always consult with the patient's primary care physician and ensure they receive the necessary pre-operative treatments. In case of thyroid storm, act quickly to stabilize the patient and seek emergency medical help. Thank you. Wish you best of luck.